And then I'm going to introduce myself. My name is Mary Ott. I'm a professor of pediatrics and adolescent medicine and a pediatric ethicist at the IU Center for Bioethics. And I'm going to talk today, I'm going to give a treats talk on the ethics of virtual engagement. And this is the first of what I hope will be several treats talks where we deal with research ethics issues specific to conducting research during a pandemic. I do have disclosures. My spouse is an employee of Eli Lilly, and I've provided expert consultation on adolescent contraception for Merck and Bayer. And my objective for this talk is to think about like what I call key ethics benchmarks for virtual research in a pandemic setting. And Heather, it looks like will be manning the chat. So please feel free to enter questions into the chat box. And I will just let people know I just got a message that my internet was unstable. So if I disappear, I will relog in. So I started thinking about this topic about ethical issues in virtual engagement as a part of a consulting job that I had in Uganda with investigators from Colombia. And we were interviewing young people about HIV research experiences. And the question was, with the onset of the pandemic and social distancing, could we transfer these in-person surveys to phone surveys? And the surveys were being done in rural villages, very high poverty settings, but most families did have a phone, at least one per household. In the organization International Initiative for Impact Evaluation had just published this commentary on the use of caution in phone surveys. And they were thinking about in high poverty settings, what role does a phone play in a family? What other stressors do families have as a result of the pandemic? And would the phone survey advance the health and well-being of the individuals that you're surveying? And so it had me start thinking about what does it mean for what are the ethics issues for virtual engagement for our own research here in the US. So when I want to start with talking about what virtual methods include, I mean, there's a huge range of virtual methods. There are a lot of specific methods. They range from surveys to social network analyses. In adolescent HIV, we're seeing a lot of online clinical trials looking at behavioral risk reduction. It can include social media research, cyber ethnography, focus groups, interviews, Delphi studies. So a whole range of methods can be done virtually. It can be quantitative or qualitative. And these methods, virtual methods, can be done via phone, video, online, social media, email, text. So if you can think about a way to communicate, you can think about a method to deliver virtual research. And finally, it can be synchronous or asynchronous. So, you know, a survey might be asynchronous where you're sent a link and you can just follow the link to the survey and do it whenever you'd like to. A focus group could be either synchronous or asynchronous, where you could get everybody on Zoom together and do an in-person or virtual in-person focus group. Or it could be asynchronous, where people are given links and have a series of questions and they can see other people's replies to the questions and they have a time period where they reply. So there's a variety of different methods that are included in virtual methods. It's a big umbrella. And so the first thing, my first sort of thinking about benchmarks, and this is adapted from work Ezekiel Emanuel had done, thinking about benchmarks for research in general. But the first one is scientific rigor and virtual methods. And you may say, well, scientific rigor, that's like science, that's not ethics. But But scientific rigor, it turns out, is like the first ethical hurdle that research has to go over, because research that's not scientifically rigorous really shouldn't be done, because we're taking participants' time, their energy, we're setting expectations for them, we're exposing them to harms. So if our participants are taking on this burden, then we really have an ethical obligation to make the research that we're doing as rigorous as possible, so that it can change and improve individuals' well-being. And there are certain aspects of virtual methods that are where rigor tends to fall off, and I'd like to talk about those a little bit. One of them is recruitment, and a lot of times there's let's round up the usual suspects for recruitment, and there's reaching out to people that we know, to groups that we know, to existing groups, and that may or may not be okay. I mean, we really need to ask ourselves is who is present, who is missing. So if we are doing Facebook ads, who doesn't have access to a Facebook-owned social media account? What's the denominator? Are participants who they say they are? And I have some examples of these. There can be barriers to participation that would affect recruitment, so particularly device and Wi-Fi access. So our colleagues that do work with older adults, I still have many older adults that have flip phones that use landlines and not devices, people that have very limited or no Wi-Fi access. Thinking about generalizability, or in the case of qualitative methods, transferability of the research. And then have we thought carefully about adapting methods for virtual engagement? So thinking about surveys, if someone's doing a survey on a phone, on a small handheld device, then there's sort of more limits to the number of questions that you can ask if they're following a link on a computer to REDCap. If someone is participating in a focus group and we'd like to move the focus group to online, what does it mean for participating in the focus group? Zoom, for example, only allows one person to talk at a time. Can you do combinations of Zoom and chat? Can you thinking about like what are the limitations of the technology? How can we overcome these limitations of technology? So I think about thinking about scientific rigor. So a colleague of mine did an online survey many, many years ago about pro-ANA and pro-MIA, or pro-anorexia, pro-bulimia website use. And the investigator recruited 18 to 26-year-olds. Her IRB did not want her to recruit younger participants because they were concerned about minor consent and harm. So what proportion said they lied about their age? And I can actually see chat, so if people want to throw in some guesses in chat, that would be great. The other question is like thinking about recruiting. I'm working with a colleague and we're thinking about like, and she's looking at recruiting young adults for a study of sexual health access from Facebook ads and thinking about who's missing. And I'm going to go back to the first one because we have like, oh wow, people are like 40%, 20%, 30%. So it turns out that it's like 10 to 20%, which I thought was like a huge number. Thinking about who they are, who they say they are. So the recruiting young adults for a study of health access from Facebook ads. And the one thing my daughter pointed out to me where I was wondering about Facebook for young adults, she said, Mom, Facebook actually owns Instagram. So who's missing from this study? Who's not in the study? So thinking through these questions, like, does the person have a social media account? Do they routinely use social media accounts? Are there, what are the biases that you get in a social media account? And then, if you're thinking about it, what's your denominator with a social media account? And finally, I had colleagues that have done a lot of really innovative work on HIV out of Chicago, and they assembled a virtual focus group of 20 LGBTQ adolescents to discuss HIV risk. the question came up is how generalizable are their results? In thinking about, does their group of 20, who do they represent? Who did they recruit? Is it generalizable to the entire population of adolescents with who are gender or sexual minority? Does it, is it limited to kids that have access to their recruitment, who have adequate Wi-Fi, who have devices, who have, so thinking about what does it mean and who you're recruiting ends up being really important. So there are also scientific pitfalls in terms of implicit bias and structural racism. So pandemics, we all know that pandemics make fear much worse. I gave a talk to the international school faculty on the effects of the pandemic on adolescents, and one of their biggest concerns were Chinese exchange students and how to handle the discrimination that they were seeing that was happening and the racism that these young people were experiencing in the early weeks to months of the coronavirus. Structural racism is something that we need to keep in mind, but particularly in times of social and economic stress. Because when we're in times of stress, it makes the effects of structural racism worse. And so thinking about thinking about our research questions, our recruitment strategies, sort of who's there, who's not there, how we're asking the questions, and, are there any aspects of what we're doing that would actually worsen structural racism, or are our methods such that they would address issues around structural racism? So the second piece is social value, and that sort of builds on this issue of, are we addressing something that's going on right now? So as I said before, pandemic conditions cause high levels of distress. And does the research itself address either like the health, the economic, or social well-being effects of COVID-19? And if it doesn't, is it an additional burden on individuals who are already struggling to deal with pandemic conditions? People who, beyond sort of the illness and the health effects of the coronavirus itself, thinking about what's happening in terms of jobs and job loss, distancing from family and support systems. So are we adding additional burden to participants? And is this research that absolutely has to be done right now? Is there social value to the research? And will it worsen levels of distress that people are feeling? Informed consent. And this is something thinking like as much in a virtual setting as in a pandemic setting, but thinking about the economic and social stressors. These types of things interfere with people's cognitive processes. We think differently when we're stressed. Scarcity also changes people's responses. So people having difficulty putting food on the table might look at a research study really differently than not people who aren't putting food on who aren't stressed about putting food on the table. And then finally thinking about, is there any undue influence in what's happening? And this is something that gets bandied about a lot. I mean, for something to be undue influence, it has to be an excessive offer. So a $20 survey versus a $200 survey versus $1,000 for a survey. It has to be something that exposes, that would make the person make a choice that a normal person wouldn't make that he wouldn't make under other circumstances. And then it would have to be something where it engages high levels of risk. So the excessive offer, making a choice you wouldn't otherwise make, and excessive levels of risk. And that's really, it takes a lot to do that. But I mean, as we think about different methods, thinking about, is there any possibility that this could happen? And finally, thinking about virtual privacy and confidentiality. So like on the left-hand side, I mean, this is we're not seeing this now. This is like a Starbucks table, a coffee shop table with people sort of sitting and working together. But if thinking about having like a family of 4 in a 2-bedroom apartment, like, or you're interviewing the mom about sensitive issues, like where is she physically at? Is there someone nearby her? Is she able to be private? So in privacy are people knowing a participant's business. So thinking about, and then from a research, like from an SOP perspective, are there things that you can do to assess privacy? Our psychology colleagues in clinical care oftentimes have like standard procedures where they check, are you in a room? Who else is in the room with you? Are you able to be in a room alone? Is there a door that closes? Can other people hear you? How long will you have this level of privacy? So that, and thinking about that from a research and building that into our SOPs. Confidentiality has to do with protecting personal information and really is more about data security. And I just put up like the Forbes article on hacking Zoom. But thinking about as we move forward with our methods, like what are our data security procedures? Is something HIPAA compliant? Is like sort of what, you know, like what is our sort of chain of data as it moves electronically through the system? Thinking about if you're having focus groups, setting it up so that there are passwords and things like that so you don't get sort of Zoom bombed. But thinking about these types of things as we move to virtual, things that we take for granted in in-person work. The other thing that's more complicated than just sort of setting up an SOP around making sure the person has a private space or setting up electronic protections for data are thinking about this blurred distinction between public and private in social media. A lot of research and recruitment is done nowadays through social media. But, you know, I'd like, I sort of ask the question, if you're analyzing social media, is one person snapping a photo to another person, is that public domain? Is that private domain? Is it public domain if it's is that a legal question, or is it a question of people's perceptions? You know, Facebook has really been sort of determined to be by and large sort of public domain, but a lot of times, particularly when you have groups, Facebook groups, people may feel that it's more private and that they're sending it to a smaller number of people. So thinking about this as if you're using social media approaches, particularly for research methods or for gathering data, thinking about this like sort of like the distinction between public and private, potentially talking to some users and doing some outreach around it to see how people feel, like the people that you're studying would feel about it. And keeping in mind that while like distinctions are often very clear in terms of like access in the law, they're oftentimes very blurry in terms of people's own perceptions. So 5 would be protecting virtual participants. So we talked about privacy and confidentiality, but you know, there's a lot of things are really stressful right now. And if you're collecting qualitative data from individuals, how do you handle disclosures of abuse, of interpersonal violence, of suicidality? And I have some examples on the next slide. So in a virtual advisory board, one of the young people say that they're having trouble getting up in the morning. They cry all the time and they wonder if life is worth living. Like, what's our ethical obligation to this participant? You know, what can we offer this young person? And what do we need to think about ahead of time before we do a virtual focus group or a virtual advisory board if we get this type of disclosure? You know, we see this in qualitative research, but you can also see it in quantitative research. A lot of work that people are doing are including measures of mental health, of distress, of depression. In one Qualtrics survey of reproductive health access, the investigator included a PHQ-9 to screen for depression. Several participants scored very high. Like, what are our ethical obligations to these individuals? Do we report? Do we not report? You know, and, you know, at what point do we take action? This is something where I would say, like, as an adolescent provider and an adolescent researcher, I'm much more commonly in the camp of reporting, because our reporting requirements with minors and young people are much more stringent than reporting requirements for things like domestic violence or are for adults. But also thinking like ahead of time, what does this mean for your SOP? What does this mean for your research procedures? What do you put in the consent form? So thinking about, like, can these considerations need to go in up front in terms of like how to handle people in distress? What are the procedures that the research staff member will take? And while this is like a standard part of research, I think when we're thinking about a pandemic situation, we really need to consider that these things may happen more often. The other safety thing is thinking about the importance of phones in all low-income settings, both international but also domestic. I mean, phones are frequently shared devices. So thinking about confidentiality, thinking about like families' access. So for many families, it's the only source of communication or contact. They may need the phone to receive calls. They may need the phone to apply for jobs and benefits. So like, what role does the phone play in their household? And, you know, what does it mean to be tying up a phone for research time? And then are there costs that are hidden that we should take into account when we're working with people in low income settings? So do they have limited minutes, or do they have a limited data plan? So, and then the final thing would be thinking about engaging affected communities. So thinking about like our research, like all research should be done in ways that elevate the dignity, enhance the empowerment of the individuals that we're serving. And so thinking about like, who's our target population? What's the health issue that we're studying? Who are the individuals most affected by it? And then looking at our virtual procedures, and are we treating individuals with dignity? Are we valuing and respecting their time and their efforts? Are we empowering them and partnering with them? Thinking about shared goals and responsibilities. And so thinking of like, and this would be certain aspects of it, issues around safety, issues around privacy, getting community input would be very important. Truth telling, providing communities with facts, letting them determine good and harm. So it may be that a survey that's not specifically on COVID, but is on something related to mental health may be actually really appreciated in communities. And then thinking about sustainability and ongoing benefit. So are your participants going to benefit not just from this like single interaction where they might have like get reimbursement or access to other goods, but will your work sort of be sustainable and in an ongoing way? And these are more generic types of best practices in community engagement, but I think particularly in pandemic situations, we need to keep them at the front of our mind. And then I'm done. So that's our little treats talk for today, and I'm open to questions. So I'm gonna actually unshare my screen so people can see me, and you can either ask questions or put them in chat.
Mary, Peter Schwartz here. How are you?
I'm good.
Okay, good. That was a beautiful talk. Just wonderful. Really enjoyed it, and definitely raised a lot of important issues. The one I was wondering about was the question of whether enrolling people in research now will impose harms and burdens that it wouldn't usually. As you know, and we talk about a lot together, sometimes, you know, IRBs and others worry that research is more burdensome sometimes in other settings than we think it is. We think actually participating research can be a benefit to an individual. I know in some of your work you've done with sensitive topics in adolescence, people have worried about the burdens on adolescents for participating, but you've seen benefit to them. does that apply here as well? And I was going to link that to the question of paying participants, which again you raised as well, which is, this can be a source of some income for some people, and an opportunity to talk about issues, perhaps stresses that maybe need to be addressed, can be expressed and listened to in a way that is not happening otherwise. So I totally respect a lot of things you raised that I had not even thought about, especially about sharing phones and privacy in the home. You would think I would have thought of that given the lack of privacy in our own home, where I am now, where you'll probably hear a screaming child before I finish this question. But and my video is off because you don't want to see me right now. But I wondered whether there are some benefits that maybe should be taken into account as well, and maybe a special benefits in this situation.
Yeah, I think, Peter, thank you for that question. I think that there may be benefits in certainly thinking about, like, all of my work with adolescents is with adolescents, and there are absolutely no summer jobs now. And like thinking about, is there a research opportunity while young people are out of school that they could participate in, that's something pro-social that they could be reimbursed for? So thinking about this as like a pro-social thing. You could also see this helping communities, thinking about like looking at like reproductive health access has in some areas of reproductive health been almost completely shut off. And even like ERs are our like sort of safety net for reproductive health access. And because of COVID and related fears, there are more barriers to going to an ER. So like this might be something like a study of reproductive health access under pandemic conditions might be something that young women of reproductive age may actually want to see and may feel that is beneficial to them. But I think the key piece would be like thinking about thinking about engaging to test this, to engage communities and thinking about like, how does the community feel about it? How do the people that you're going to be working with feel about it? And that would be, and I probably didn't link my last slide on community engagement as explicitly as I should, but it's really sort of a solution.
Can I just follow that up with one more question, Mary? Again, excellent points, excellent response. Also, I was thinking about the issue of focusing our research right now on, like you raised that in terms of the focus of research in this setting where we have, a number 1, number 2, and number 3 health problem, or COVID. There's a danger perhaps of forgetting other health problems and losing traction and momentum on other issues, again, without taking away from the incredible pressing need to do the best we can with COVID, but also looking at other things. Is there, in terms of the ethics of choosing a topic, you don't think it's all COVID all the time now, obviously. Is there a change, though, in prioritizing research areas?
Peter, I was really thinking about like using virtual methods to engage like marginalized and minoritized populations. And I just wanted to put it up as a, these are we looking at a group of individuals that's really stressed right now by COVID? And and I think this question of, is there social value to the research? So if you're doing like research on children with cancer, caregivers of children with cancer, then, like, I think thinking about like, what's the social value now? What does your population say about it? I think that this is a population of families that would want to participate and want to have the research going on. If we're doing research on a topic that's not related to what's going on now, then, and we're doing it with a population that's been thinking about like, what's the burden to the population in terms of not just COVID as a disease, but the social and economic effects. I think it's like one of these things, thinking about like social value, what does the engaged community say? But I don't want my slides to be an absolute, like, stop, you can't do this. I just want them to be sort of, let's ask this question and make sure it's still a relevant question.
Outstanding, Mary, thank you.
Any additional questions? I'm happy to take them in chat. I'm happy to have people just sort of yell out a question. So there's a wonderful comment in chat, like from Zainab Salih, about thinking about issues with not being able to notice emotional responses of participants and not able to respond in virtual interviews. And I think this is a really important point, like we lose nuance. Particularly if you're doing it by phone where you can't actually see the person. And this may be something like would be again sort of a consideration as you go from in-person interviews to virtual interviews, particularly if you're doing work like Zainab's doing, where Zainab as a neonatologist does a lot of work with like parents of extremely high-risk newborns. And so not being able to gauge emotional responses ends up being really important, and being able to engage emotional responses is important to the interview. So I think this is a key thing. Some of the things about would be like sort of setting it up as ground rules. Like if the person feels that they're not able to answer a question, if they feel choked up, if they feel like the question is intrusive, giving them permission to say, I need a little bit of time, or I'm not comfortable answering that question, and perhaps being very explicit about it rather than having it be something that you notice and go along. And again, sort of these are the types of things like ideally we could all think through before we do the flip to a virtual method. Additional questions? You are all welcome to email me separately if anything comes up. What we'll do, there's a question about slides, and I will send my slides to Ta Yogo, who is the center manager, and he will make sure that people have access to slides, potentially posting them with the talk.
Can I jump in again, Mary?
Yes.
Peter, and just, yeah, thanks again, Mary, for an excellent talk, and so topical, and I'm so thankful for it. The Center for Bioethics is also opening a website on COVID ethics issues, especially related to Indiana. And one of our topic areas is research ethics in this time. Mary's talk will be posted there, as well as to the treats page. Again, this is the monthly talk on the translational research ethics applied topics. So it'll be posted there along with possible references, including what I assume is the paper that Mary will write and will be published in a very highly prominent journal about this topic. That's an excellent insight and application of this topic. I'm not kidding. I think that's I haven't seen this discussed, and I got feedback from people when your title was announced, Mary, saying this is such an important topic and something has to be addressed. So thanks again. That's just want to make sure people knew that there's this opportunity to see things related to ethics. We'll be posting that live probably early next week, along with all the other ethics topics.
Yeah. Thanks to everybody for dialing in, being a part of the conversation.